Everyone, and welcome to episode 2 of Ride Along with Dr. V. This week's question is coming from one of my TikTok followers. This TikTok follower has been dealing with a condition called posterior tibial tendonitis. Don't worry, I'll explain what that is. And so she's very frustrated because she did go to the doctor. She went to the doctor. They've tried many different conservative treatments. She is currently in physical therapy, and she's just really frustrated because she's not getting the results that she's looking for. So she asked me a question about that, so I wanted to go through that with you guys today. So what is posterior tibial tendonitis? So that is when your posterior tibial tendon starts to misfunction or becomes irritated. So what is your posterior tibial tendon? What is that? So that is a tendon that runs down the medial side or the inside of your ankle, and it goes down and attaches to your arch, right? And so its job is to hold your arch up and support your arch. So imagine it's sort of like a cable that extends from your ankle down to your arch, and it holds it up, right? So when that tendon becomes overloaded, which means we just give it too much work to do and it can't handle it all, it becomes irritated, right? It becomes inflamed, and then it eventually starts to misfunction or dysfunction. So we kind of stage this condition. The first stage is just irritation, right? So you have mild pain, but as the condition progresses and we get to stage 2 and 3, we actually see some structural changes that happen in the foot. So as we get to 2 and 3, we see your arches start to drop, right? Because again, remember, its job is to hold your arch up. And if it can't do that, the arches drop, right? And so depending on the stage that you're in, it really determines the treatment options that we do for that. So in the beginning stages, we do more inflammation control, more support of the foot. And then as you progress to the later stages, sometimes we have to get bracing involved and things like that to assist that tendon. So with any of these conditions, guys, the first thing that I always recommend is making sure you have a correct diagnosis. Please don't try to use Google or ChatGPT to diagnose your foot conditions. Go see a licensed professional who can give you that correct diagnosis. Get the right testing done so that your treatment options are tailored to you. And then the second thing is understanding what stage you're in, right? Because as I mentioned, at different stages, the treatment options are totally different, right? So understanding and making sure you have the correct diagnosis and you understand your stage will be where I would start with this condition, right? And with any condition, you guys, if you're doing something and it's not improving your condition, go back to your doctor. Don't keep doing the same thing with no results, right? So that's what I recommend. And that's it for episode 2. So if you guys have any questions about your feet, it doesn't have to be about pain. It could be about anything. It could be, hey, I got this weird toenail. What does that mean, right? So whatever questions you guys have, that is what this ride along is for me to be able to answer those for you. So go ahead and comment below, and I will get your questions answered. And remember, when your feet feel good, everything else gets a little easier.